Hi students.
Hi students, so today we will learn about critical thinking. So yesterday I had shown you the video of critical thinking just to get an idea about it as well as regarding the nursing process. So the main topic what we are going to learn in this unit is about nursing process. Nursing process, you have different steps which you have seen already in the yesterday's video. So to learn about nursing process, before learning about nursing process, we have to learn what is this critical thinking, because when you do the nursing process, when you follow the nursing process, you have to know about the critical thinking. So critical thinking involves recognizing that an issue, okay, you're recognizing a patient's problem, the existing problem, as well as analyzing the information about the issue. Okay, so once you know the problem, you are going to analyze it, whether it is true or false, or what is triggering, okay, whether it is the reality or too high, whether where it is radiating. These kind of analysis you're going to make. Okay, what is the cause of it, how it can be cured. So you're analyzing, okay, you're thinking critically. For example, clinical data about a patient, that's what, then evaluating the information and making a conclusion. So you will collect all the data, you will evaluate that data, and then come to a conclusion. That is a critical thinking. So the definition, what is this definition of critical thinking? It is a continuous process characterized by open-mindedness, continual inquiry combined with a willingness to look at each unique patient situation and determine which identified assumptions are true and relevant. So it is a continuous process which is characterized by open-mindedness. Open-mindedness means you are not going to ask any question, but you are going to listen what the person says, okay, without making any kind of judgment. You're going to listen. That is open-mindedness. Continual inquiry combined with a willingness to look at each unique patient. So you know that each patient is unique, you've heard about it, but when you do the critical thinking, you have to keep it in your mind that each patient is different, and though the complaints will be similar, their cause, their length of recovery, everything differs. So you have to think critically about all the informations what you get from each person, okay, and determine which identified assumptions are true and relevant. So this is a definition. So next we will see what are the skills of critical thinking. So interpretation, analysis, inference, evaluation, explanation, and self-regulation. So these are the different skills of critical thinking. So first is the interpretation. Interpretation means collect and clarify the data in an orderly fashion. So you will be collecting first and foremost, what are your complaints, whether it is hereditary, you're going to come, you are okay, from when it began, all these things. Okay, collect and clarify the data in an orderly fashion. Collecting the data as well as you have to clarify it, whether what you have understood is proper or not. Then regarding the analysis, be open minded and do not make any kind of imaginations. Then inference, look for the relationships within information you have collected. So whatever information you have got from the interpretation, you have to see the link between those informations. So when you know that there is a link between the information, you obviously you will come to know that that is a relevant one. If there is no proper link, okay, then you have to go in depth again. Okay, depth, that to understand properly, to have the connection from one sentence to another, from one information to another, you have to go in depth when the inference is not clear. Then regarding the evaluations, be objective in nursing action that need to perform. Okay, you have to be objective. Then explanation, make sure you have support in your conclusion and use experiential knowledge and scientific basis. So regarding explanation, when you have the explanation, you have to check whether it is scientifically relevant. Then self regulation, review your methods and correct any problems identified. So, what are the different levels of critical thinking? You have the basic, complex, as well as commitment. So, at the basic level of critical thinking, a learner trusts that experts have the right answers for every problem. Thinking is based on a set of rules or principles. So, this is the basic critical thinking. The learner trusts that experts have the right answers for every problem. Then, complex one. Complex critical thinkers analyze and examine choices more independently. The person's thinking abilities and initiative to look beyond expert opinion begin to change. So this is after basic. Basic means you will know that the experts are, I mean, they will know more answers about the one situation. But complex is the thinkers, they analyze and examine the choices more independently. The person's thinking abilities and initiative to look beyond experts' opinion begin to change. So, in complex critical thinking, each solution has a benefit and risk that decides before making any final decision. Then, regarding the commitment, the third level of critical thinking is the commitment. At this level, a person makes choices without assistance from others and accepts the accountability for decisions which is made. Accepts the accountability means whenever he or she does any kind of, decision, you have to be able to answer why you have made that decision. That is the accountability. If anyone comes and asks, if anyone from the higher authority comes and asks you why you have done this, you should be ready to answer why you have done it. You should that answer should be very much relevant, and it should be efficient. Okay, that is about the commitment. So this is the level 3 is the commitment, level 2 complex, and level 1 is the basic. Then regarding the thinking and learning. So it is a lifelong process. Thinking and learning is a lifelong process, flexible, and it is an open process. Learn to think and to anticipate. Anticipate means whichever is not occur, but you are guessing or you are thinking that this might happen. So learn to think and to anticipate what, why, how questions should be there. Look beyond the obvious. Then reflect on past experiences. So I have told you that each patient is different, but from each patient there is a lot of things to learn. Okay, that's how you become expert in providing the nursing care. So you have to reflect on the past experience when you get a similar kind of patients. Then new knowledge challenges the traditional way. Okay, next is regarding critical thinking competencies. So, critical thinking competencies is a cognitive process in which nurse uses to make judgment about the clinical care. So, this include general critical thinking and the specific critical thinking. So, what is this general critical thinking and specific? General critical thinking involves scientific method, problem solving, and the decision making. Scientific method is the nursing process what you're going to use. Then problem solving means in that only how you're going to solve the problem. Whatever information you get, you have to use the problem solving thinking method. Then about the decision making. After problem solving, you come to an end of solving the problem. You have to decide which is better. So always you have to have the option like plan A, plan B, similar kind of thing. So you have to decide what is relevant for that particular patient. Then specific critical thinking. So on the diagnostic reasoning, clinical inference, and clinical decision making. So, scientific method, this is the explanation. There are 5 steps: problem identification, that is the assessment, then collection of the data, then formulation of a question, testing the question, then evaluating the result of the test. So, formulation of a question, then you are going to test that question whether it is relevant or not, then come to the result of the test. Then, problem solving, when a problem arises, obtain information and then use the information and previous knowledge to find the solution. Decision making, it is the end product of the critical thinking that focuses on problem solution. So when you face a problem and need to choose a solution from several options, you are making the decision. So from different options, you have to make a decision which is right for that particular person. Then, diagnostic reasoning. There it is the process of determining client's health status after receiving information about the patient. The diagnostic reasoning, it is a process of determining client's health status after receiving the information about the client. So after receiving the information about the client, you are going to determine what is the health status. Clinical inference. So it is a process of drawing conclusion from the related pieces of evidence. So whatever information you get from that particular person, you will come to a conclusion. That is the clinical inference. Then clinical decision making. It is a problem solving activity that focuses on defining client problem and selecting appropriate treatment. So you are focusing on the client's problem and selecting the appropriate treatment. That is, clinically you are making the decision. Okay, so next is regarding the attitudes of critical thinking. First is the confidence, then you have the thinking independently, fairness, responsibility and accountability, then risk taking. So confidence grows with the experience in recognizing the strengths and limitations. So there should be a confidence. Then thinking independently, reasoning are essential to improvement and expansion of nursing practice. So though there is a lot of things written in the book, you have to think, okay, what is good for that particular patient by the benefit of the patient. Okay, in that view you are supposed to think. So thinking independently. One small example, if I can give you, um, a person with the see in the hospitals every morning. Okay, every morning while giving the handover, bed making will be done every morning, or bed bath will be provided. But if in case if the person is bedridden and bed making is already done in the morning, but then after 2 hours again the bed sheet gets wrinkled, what are you going to do? You'll do the bed making again, or you'll just leave it for the next day. What are you going to do? Thinking critically. If you leave it for the next day, what happens? There are possibilities that the person might suffer from bed sore. But if you're doing it, you can prevent it. You can prevent the signs and symptoms of the bed sore. So this is the thinking independently, thinking critically, thinking independently. Okay, fairness. A critical thinker deals with the situation justly. Okay, doesn't think a lot of things, but what is good for the patient from that view, you will do. That is the you're providing the fairness for the client. Then responsibility and accountability. So when caring for the patient, the nurse is responsible for correctly performing nursing care activities based on the standards of the practice. So whatever scientific reasoning is being given according to the procedure, what you are going to learn in the fundamentals, you're going to use that while providing the care to the patient. So you should be responsible and you should be accountable. Risk taking. A critical thinker is willing to take the risk in trying different ways to solve the problem. Discipline. A disciplined thinker follows a systematic approach when making decision or taking decision. Then perseverance. A critical thinker works to achieve highest level of quality care. Minimal effort will be not satisfied. Creativity to find solutions outside of the standard routines. Curiosity, it is the interest to gain new knowledge. Integrity, nurse should be honest, truthful, and willing to accept their mistakes. Humility, it is important to accept any limitations in your knowledge and skills. So it is important to accept any limitation in your knowledge and skill. uh, I hope you have understood this point. What happens is when a nurse is providing care for the patient in the hospital, at times she may not have the few knowledge. Okay, she may not know, for example, while providing the medicine, She may not know the actions of all the medicine. She may not be knowing the side effects of all the medicine. So that time it is okay to ask someone. Okay, it is very much okay to ask someone what is the action, what is the side effect. It is very much okay. Should not get insulted or should not shut her mouth and sit without asking, because if you don't ask anything like this, what happens is the patient might be at risk. So it is okay, it is important to accept any limitation in your knowledge and skill, whether it is junior or senior. It is okay to ask, because no one is an encyclopedia, no one knows everything. Okay, everyone are learning in every stage of their life. Everyone are learning, everyone are gaining knowledge. So same way. Okay, so I hope you have understood about this critical thinking. If any doubts, you can ask me. Okay, thank you.